Hi, I'm David Stoker, and I want to welcome you to the Better Life in Recovery #Hope Dealer Movement podcast. As a visible and vocal member of the recovery community since 2009, I'm frequently asked questions and for advice from people all the time. Some are curious, some are still using, some are in recovery, and some people just care about somebody who's currently struggling with a hurt habit or hang-up. If people in my community have those questions, I guarantee that people everywhere are looking for answers as well. We started this podcast to give you answers and support, because not only is recovery real, it is amazing. Hope you enjoy the show. So this is David Stoker, and today we are going to be talking to Tom Hill. Tom Hill is with the National Council on Behavioral Health.
For behavioral health, right?
For behavioral health. And I may let him talk really quick about what the National Council for Behavioral Health does for those who aren't familiar with it.
Well, National Council, David, is it's a large organization. That's a member organization. So we have a range of members that are mental health and addiction providers, as well as state associations. We have strategic partners. It's a very complex system that works really, really well. We have 150 staff, mostly based in Washington, D.C., and we do a combination of practice improvement and advocacy. So for every program that we put forward, we also do policy work on Capitol Hill to make sure that everything that we're proposing in terms of new practices and new development has policy backup and regulatory backup. So it's a combination of those kinds of things, and it's worked pretty well.
Okay. Now, I'm really excited to talk to Tom for a couple reasons. For starters, me and him have a lot in common. We're both in long-term recovery. We both are blessed to not have hair on top of our head. We both have MSWs, and we are both incredibly charismatic. So I think this should be a really fun interview for everybody.
That's right, David.
So how long have you been in recovery, Tom?
Almost 27 years. In June, it'll be 27 years of, I define that as living without alcohol and drugs for all that time.
That's amazing. Congratulations.
Yeah, thanks.
So I'm not here to talk about your recovery, unfortunately, but what was the one big thing that impacted you and has helped you not just attain but maintain your recovery?
Well, I think, for me, it's been, it certainly has been a spiritual quest, and it's been an evolving spiritual quest over the years, and I've learned a tremendous amount, tremendous about myself and background of trauma and how I dealt with it then and how I deal with it now, and then just, availing myself to all the gifts and treasures that are available through recovery. I've had a really, really amazing life in recovery. So I live a daily life that I could never even have imagined when I was out there using.
I say that. I'm like, sometimes I wake up in the morning and I have to pinch myself
Yeah.
because I can't believe that people actually pay me to do what I used to do for free.
Right. Sometimes I think, I get all overwhelmed and it's like I've got so much to do and how am I going to get all this done? And I just have to stop and take a breath and realize what a life of abundance is and how fortunate I am to have all of these problems and issues
right.
That are taking up my time and energy. It's all good stuff. Yeah.
Absolutely. I like what you talked about, that the growth. I think of the SAMHSA definition of recovery where it talks about striving to maintain your full potential, and I think that's a huge part of recovery. It's an action word and it's an ongoing action word.
Yeah, and I it's like I don't know that I know that I didn't know what my potential was or how to get it.
Right.
And that caused me so much baffling pondering that things became much clearer and much less vague when I was in recovery, and other people around me pointed out that I was good at certain things that I had shied away from my whole life.
Right.
Leadership, right? I was terrified of leadership when I was using. Always hid behind, so to be able to step forward and be confident about that is a pretty big thing in my life.
And speaking of leadership and the SAMHSA definition for recovery, for those who aren't familiar, SAMHSA is the Substance Abuse and Mental Health Services Administration in the United States, and they have their hands on a lot of things. But Tom, you were a presidential appointee.
Yeah. I was an Obama appointee in that administration, and I served as senior advisor to the administrator of SAMHSA, as well as I was the acting director for the Center for Substance Abuse Treatment.
I mean, how does that feel? I mean, to be at that level of a career where a president, somebody who's been elected at a national election as the person to be the commander of the free world, as they say, said, hey, you know what? You're the guy that I want to do that.
Well, I was a big fan of Obama as our president. I won't be shy about that. So that was a huge honor. And I wasn't the only one. My friend Tom Cadera was a presidential appointee, and Michael Botticelli was, the drug czar at ONDCP, and we were all out about our recovery. And so it wasn't something I sought out. It came to me. I had to sort of grapple making that decision whether to do that or not. So many people said, of course you have to do it. And it was a real gift and honor, and I learned so much there and was able to participate in certain things. But David, one of the things that was really a turning point for me was I've always said, social change comes from the bottom up. And so you need people that'll work inside and outside the system. So when I was there, I really underestimated how important it was to the recovery community that they had a representative in a high-ranking place like that. And I got so many, emails and calls of people that were just so proud. But the whole thing was that, to be able to be in a position like that and open doors and invite people in from the community to be represented in meetings and task forces and those kinds of things was just a huge opportunity to include lived experience and community representation on issues and decision-making boards that mattered.
Right. And I think that's huge. I know... in the world of disabilities, they kind of came up with the nothing about us without us.
That's exactly where it came from. People always forget that, but that's the community it came from.
And that's something that I think, unfortunately, the recovery world is really just starting to latch onto. I think even though it kind of started, I mean, if you look back, Bill W. actually testified in front of Congress on national TV.
Marty Mann, it's in the late 40s and early 50s with the National Council on Alcoholism. We have a rich but spotty history, right? And I've been doing this work since 1998 with the Recovery Community Services Program that was a SAMHSA grant, a CSAT grant, to mobilize the recovery community. And so that was 20 years ago. And so I've seen tremendous change in 20 years, but again, it's a drop in the bucket. We have so much work ahead of us. And sometimes it feels like one step forward, two steps back, and I'm trying to change that up to 2 steps forward, one step back. But I am really proud of how far we've come in a really short amount of time.
Yeah, I still, whenever it comes to community organizing, one of the problems I still run into sometimes, and I don't want to single anybody out, but I feel like I have a foot in both of these worlds, so maybe I'm calling out myself too. The faith community and the 12-step community, a lot of times there's this, they don't want to get involved with something that isn't theirs. They're like, well, that's not my fellowship, or you know what, if that's not 100% about the group that I'm involved in, then I don't want to then I'm not going to invest in it. What do you do to get some of those organizations or people from those communities involved?
Well, it happens on all levels, David. So it happens with the recovery advocacy folks and the harm reduction folks. It happens with the faith-based folks and the 12-step folks. It happens with treatment and recovery services. It's and I just get so tired of this. It's like, folks, we have a great sense of urgency before us. People are dying. People have always died of addiction, but it's sort of in our face right now. People are dying. We want to save people's lives, and we want to help them reach their full potential and get better. right? I mean, isn't that
Absolutely.
the goal? And if we keep our eye on that common goal, which we all like get into our little niches, our own protecting our own funding streams, our own sense of self-importance, our own ego, it gets in the way of the work. And the work is, do we want people to get better or not? And are we going to work together to make that happen? Because the people we're talking about are people that like you and me, David, people that society traditionally has not cared about.
Right.
And has diminished our value in the world. And we're turning that around and saying, wait a minute, we have tremendous value in this world. We're living proof that recovery works, and it's manifest in our lives, and we can make that happen in other people's lives. But it's, we need all hands on ship in order to make that happen.
Absolutely. I spoke last night, and that's one of the things I always say when I speak. I go through some of the stuff and then that I've accomplished, and then I say, and I don't say that to brag. I say that because I want you to know the potential of somebody in recovery, and I'm not an anomaly. I'm not a unicorn. There's 23.5 million of us in recovery in this country, and yet most people, if you talk to them, they don't know somebody in recovery.
Well, and that's our own fault too, because we've stayed hidden. Right.
Right.
And so, and I say it's our own fault, but it's like, I'm gay, so I know the power of coming out. And I know, there's a whole history of people coming out and a whole movement built on that. And, just back to our earlier conversation about the slow movement of social change. So, 50 years it took, almost 50 years between Stonewall, which was the big turning point in the gay movement, and gay marriage, right?
Right.
That seems like, for a young person, that seems like an awful long amount of time. Historically, that's pretty quick. So there's things that you have to be patient, though. You have to work incrementally and hold the line all along the way. Lose battles, keep people moving forward. That's how social change works. So, but back to what you were saying, and I forgot what we were talking about now.
That happens. I go down rabbit trails all the time.
There was something about the living proof thing, and this like common ground. It's like if we can figure out a common goal or a common set of goals and common ground and work what we know as recovery principles and values around that, then I have total trust that we're going to move forward and we're going to win. Right. What I think now I'm remembering, historically people haven't cared about us, and I said that was our own fault. But people, and I talked about coming out. Some people have reason not to come out, no matter what. So they may have a history of trauma where they have a tremendous amount of fear, but they also may face consequences about being out about their recovery. Just about being out about your gay, you face consequences. But I also know personally that when you do come out, because I've come out twice, right?
Right.
That it's so liberating to not have to lie or tell secrets or hide. But until we clear the air for all that to happen, it's not my responsibility to out anybody. And if you are not ready to come out about your recovery, you can help us in other ways. But the power of people seeing the face and voice of recovery, the power of people seeing that we exist, is a very, very powerful power. And that because it changes hearts and minds.
Absolutely, and I think that's, you got to pull on the heartstrings. That was one thing at the meeting that I was at last night. There was a kid there in recovery, and his aunt was there. And, she's just bawling while he's talking because of the change, and because now when she goes to bed at night, she doesn't freak out when the phone rings at 2 o'clock. In fact, she can sleep because she knows she's not going to get that phone call that he's dead. I think it's huge. So as we're starting to organize, what are some of your tips if, say, a community is just starting to try to get together? What would you do? I know, like when we started, we called a meeting and we got, directors from the treatment providers. We got business owners. We invited politicians, which didn't show up at first, but it's kind of, as it's gained momentum, we got some of the leaders from the recovery community and brought them together.
Yeah, I mean, I'm my MSW is in community organizing, so that's what I studied in social work school, and so my first the things I learned there was the first thing you do is you bring people together, and in my experience, the first group you bring together are people in the recovery community. The other folks you mentioned, they're like second tier.
Right.
But just to bring people that are in recovery and start to ask them some questions about what's working, what's not working, what's lacking in the community that they could see happening. And people are going to be really slow at that at first because they're not being used to ask those questions. But just explore that with them about if you were going to build a recovery community in this town or this neighborhood or this city, what would it look like? And just have people start building a vision. Because I think a lot of times we move forward, but we don't have a vision of where we're going or what we're building. And so people can sort of realize their full potential, not only individually, not only in families, but as an entire community. That's a very powerful thing. And then the second tier, like once you start sort of mapping some of that out, you bring in law enforcement, and you bring in child welfare, and you bring in the Chamber of Commerce, and you bring in the mayor's office. You bring in all those folks, and then you start getting their buy-in as stakeholders. But I think for me, the impetus always has to be on recovery, and it has to be grounded in the recovery community. We give away things so quickly and so easily, and let somebody else take it over when it's really ours. And I'm going to talk about recovery-oriented systems of care today. And I said earlier, social change always comes from the ground up. It comes from the grassroots. It comes from the community. It doesn't come from top policymakers.
Right.
They're fine with the way things are. That's maybe a blanket statement, but you know what I'm saying.
Right.
And so how do you cultivate those change agents on the ground? And how do you engender a sense of ownership that this is what we've created? So the thing about ROSC didn't come from state systems or federal systems people. It came from people in the community saying, wait a minute, we're not really represented here the way we should be. We're the folks that this is all about.
Right.
Either in active addiction or in recovery, and we need to be not only at the table but sort of guiding the ship here. Right. So I think that's for community organizing, it's a really important thing that I always say people own what they create, and if they're part of creating something, they have full ownership in it. And then you invite the other folks in and say, this is what we're thinking, how can you help us, and then how can we build this together? Right.
Right. So what I noticed, and correct me if I'm wrong, but we were one of the original 15 grassroots pilot projects for the Facing Addiction a community program that they started. And as we built up, the first year I tried to stick with people in recovery, and I didn't get a lot of buy-in. When I brought in the family members, that's when I got a lot of buy-in. I got people that were there on time. They were there early. They left late. It was weird. I don't know if it's because they already have ownership. And that's something I've ran into, at least in my community, is they have ownership in their brand of recovery. And that's where they invest all their time. And a lot of the people that I approached weren't willing to step outside of that and give time to something else.
Well, that's, so I've always thought the family members were part of the recovery community. I never separated that out.
Okay.
And I think in the early days, we had a hard time pulling in the family experience. Now, everything is shifted because you have so many parents that are pissed off with the system. Right. Either they lost their kids to overdoses, their kids are currently out there. The kids are in and out of treatment. They can't get the right help for them. They're very frustrated, and they feel like they've been sold a bill of goods that has not paid off, right? So I'm right behind them. It's like, yes, you have anger.
Right.
We're going to channel that anger. So in that situation, I think you always go where it's warm. In the early years, trying to convince dyed-in-the-wool 12-step leaders, they weren't having it. Many of them still aren't.
Right.
You know, I think Greg Williams' The Anonymous People shifted some people's thinking, because it gave them a historical reference about Bill Wilson and Marty Mann and all those things. But I always say people need to know their history.
Right.
Like you need to know where you came from, and you need to know who came before you, right? But that said, it's like in those early years, I learned it's not my job to convince them to step forward with us. It's like just let them be, and find out the people that do want to step forward. It was a handful, right? So the first Pro Act in southern Pennsylvania, the first event they had, the first march was like 100 people showed up. Now they have 15,000.
That's amazing.
So and that's the same organization. So we all started off really small and just had patience and faith and we nurtured it and made it grow. So it's like it doesn't matter who's in the room. It's like if they have energy, harness it.
Right.
And right now I'm looking at the parent movement, really, really strongly because these folks have staying power, and the fact that they're dealing with a loss, which I think that kind of loss you also need to have therapeutic and other kinds of supports. You can't just do it through advocacy, but the advocacy voice is very, very strong, and policymakers listen to that.
Yeah, I always say I don't know if there's anything more powerful than some of the moms I have who have lost their kids standing there sharing their story. So we talked about you talked about Rosts, and I want to say something really quick before I ask you this question. Don Cahoyas, who is a phenomenal leader in especially in the Native American recovery community, but in the recovery community period, he talks about an illustration, and here he's talking about the culture and the spirituality of the Native Americans. And I'm talking about our communities, period, in the United States, where he says, imagine that you have 100 acres of, like 100 acres sick forest.
The healing forest analogy, yeah.
And he talks about, you take this tree out of, and I'll put it in my own words, but, basically you take this tree out of this corrupted soil in the sick forest and say you put it in a nursery and nutrient-dense soil and you give it the water that it needs and you give it adequate sun. And then as soon as it starts to get healthy, you replant it right back in that same corrupted soil in that same 100 acres of sick forest. Nobody would do that. Nobody would do that with a bush or a flower or a tree. But we're doing it every single day when our brothers, our sisters, our sons, our daughters, our moms, our dads get out of treatment, jail, prison. They're going right back to that same sick community that they came out of. And we've got to find ways to make our communities healthier. And I think the ROSC model is one of the things that has the ability to do that. So would you talk a little bit about what a ROSC is?
So first of all, I do want to pay correct homage to Don Cahoyas because I met him in 1998 and he's been, a mentor and spiritual advisor to me. And I've learned so much from him. And his models that are all based in Native American culture, I think are really cross-cultural and have used them as such. So when he does the healing forest, a couple months ago, I looked at the healing forest and I also looked at what Bill White calls recovery ecologies.
Okay.
Communities that are rich in recovery resources. And so I thought it'd be really cool to blend those two. So I wrote both of them and I said, if I took these two things and blended them, would you look at them and tell me if it works or not?
Right.
So I'm going to present that this afternoon.
That's awesome.
And so so for years, it's like if you can go to the best treatment in the world. You can go to the best treatment that money can buy. And when you leave the doors and exit treatment and you go back into the community, if that community is not equipped to handle and support and nurture recovery, you're pretty much screwed.
Right.
And so and then we have a revolving door in and out of treatment, and we blame the person for not getting it. Right? I mean, that's
right. It's the only disease we do that.
We've said absolutely. So, even like the relapse now is such an ugly word, right? It's like because it's become a blaming thing.
Right.
So, this whole idea of of recovery ecology. It's like I talked to you earlier about getting people together and asking what they would envision. It's like, recovery community centers and peer services and collegiate and high school recovery programs, recovery housing. And in my vision, they're all working in unison. So it's like this webby network that people can't fall through, and that everyone's working together to sort of make this happen. And, people always say, oh, how are we going to pay for that? Don't start there.
Right. Start
with the vision. Scale it up, scale it down, pilot it, do whatever, and then worry about how it's going to get paid for. We don't worry about how we're going to pay for cancer patients or cancer research. There's other chronic diseases that don't have the same issues as we do, and we get all caught up in, oh, this won't work because, or we tried this, and it's like, again, it's very frustrating because we put roadblocks in front of ourselves all the time. So the thing about ROSC is, it's like if recovery is built in from the beginning all the way to the end, and we extend that continuum of care, so it doesn't end at treatment. I mean, treatment is one single episode in a person's life, and we also know a lot of people don't go to treatment.
Right.
They go right into the community. So and recovery is a lifetime. So what are those supports? What does recovery maintenance look like over a lifetime?
Okay.
Because it's a chronic condition, and there's not a cure. It just needs to be maintained. Same with diabetes, right?
Absolutely.
Same with hypertension. And so you need, and those require lifestyle changes also. But you need support in order to do that. Change is really hard, and personal change. You and I both experienced that. It's daily work.
Absolutely.
Because you can always fall back into old patterns, right? But it's like for a person with diabetes to break down and have a piece of cake, we don't shame them for that. We help them get back on a regime, right? But that doesn't work the same way with people with addiction. When people pick up a drink or snort a line or shoot, it's like all fingers are pointing and saying, "See, you can't do it." Yeah.
Yeah, it's weird with this one. Like, there's some statements I don't like. I don't like relapse as part of the program, just because. You know what? The next time somebody uses, don't give people permission to use. It's perfectly okay if there's a recurrence. But you know what? The next time somebody goes back out could be the last thing they do. I also don't like never work harder than the person you're with. If you have higher expectations for somebody that's still actively using than you do for yourself, I always say go to a different job field because you're going to kill people. Yeah. But I have noticed we did that in Springfield. I started off a nonprofit called Better Life and Recovery in 2012. And the first year we did one event. The second year we did 2 events. The third year we did 7 events. The fourth year we filed for 501c3. The next year I found 2 organizations that were paying for offices. One did faith-based mentoring for treatment courts, and the other one was recovery residences. But they were paying for separate offices, and we sat down and figured out that if I brought in my people and they took the money they were using to pay for offices, that we could open up a recovery community center. So we just opened it up and, had offices in there for them, but open space, which parlayed the next year when STR grant came out. We were one of the first 2 RCCs that were actually funded in the state of Missouri. But you're right. Don't worry about the money. The money will come if you're doing the right thing. The support will come. I mean, my board started off, really, it was family and friends, and now I have state reps and business owners and attorneys, and it's amazing once you get it going. I mean, that's the hard part, is pulling the trigger, because there's that fear, I think, especially in people in early recovery. Man, I don't want to do this and fail. But the truth is, nothing happens without missteps. I mean, you've got to fall a couple times before you can learn to walk.
Absolutely.
So ROSCs are starting to be a big thing. I always talk about, it's kind of funny, you talked about treatment. Not everybody needs treatment. In my analogy, I always say treatment's kind of like surgery. And not everybody needs surgery, but some people definitely do. Recovery supports are like physical therapy, right? Some people just need physical therapy. They don't need surgery. And other people, they need physical therapy after their surgery. I mean, we walk recovery supports if you look at research, it takes anywhere from 12 to 18 months for the brain's neurotransmitters to replenish. With meth, it can take up to 2 years because the brain has to rebuild dopamine receptors. But the piece of research that's really scary is the piece that says once you attain 3 to 5 years of recovery, and for some people it's 5 years because that's how long it truly takes the neural pathways in your brain to rewire, that's the biggest indicator that you will not use again. And we don't follow people like that. I mean, somebody goes to treatment, and after 28 days, congratulations, you've graduated, and they go on their way.
Right. Avoid slippery people, places, and things. You'll do just fine.
Oh, yeah. I don't like relapse prevention plans. When I was a therapist, I always did recovery enhancement plans with the people I worked with. Let's not say you can't do this, you can't go here, you can't talk to these people. Let's say, you know what? Here's people you can hang out with. Here's places what do you like to do? Okay, let's figure out ways for you to do it. I know with our RCC, that's one of the things, we do outside events. And I never thought we'd have a bowling night, but some people like to bowl. We have a stream team because some people like to float. We play laser tag or paintball once a month because some people like to do that. We had a sewing class there because people asked for it.
Yeah, and it's like, so part of that is, being able to have socialization activities in recovery that don't involve using, because that's how we used to have fun. And also just to promote having fun. Because if we're not doing that, like, why would anybody want to be in recovery? I mean,
Absolutely.
It's like, it's not all work, it's got to be fun.
Right.
And so, the celebration that happens that when we're together, I think, we need to promote that all the time because we want to attract, right? It's like we want people to think, oh, I want some of that.
Yeah, we've got to make it look attractive. And I know sometimes there's some gloom and doom people, but I mean, the gifts of recovery, you talked about at the beginning. To look at where my life is today and look at where it was 15 years ago, is night and day. It's like walking out of hell into Valhalla. Here I have this amazing world that's been built now. And all of it is because of my recovery. I speak a lot, and people don't want me to come speak because of my degree. People want me to come speak because of my lived experience. We have so many experts. Because if you're in recovery from anything, I always say you're a hope dealer because you have the ability to share with other people that success is possible.
Yeah, absolutely.
Whether you're in recovery from substance use disorders, remission from cancer, there's so many different ways.
Absolutely.
But we've got to figure out ways to get the grassroots movement to swell. Well,
it is swelling. It's swelling at its own rate. So, 1998, 1999, 2000, lucky to get 7 people in a room.
Right.
Right? And 4 of them weren't sure why they were there. Right? So
it was for the coffee.
So I know what that feels like, and
right.
You go home and you think, oh man, is this ever going to happen? And then some sparks ignite and some fire catches and some events happen. Like I talked about the anonymous people. That was a huge turning point. Facing addiction on the National Mall,
right.
Huge turning points, and then young people coming along who didn't have any of the baggage of anonymity, or because everything about their life was an open book with
right.
social media. So they brought a whole new energy. So it's evolving all the time, and we're not going to get everybody to step forward.
Right.
Think of all the other social movements. Not everybody. In fact, the majority of people did not step forward.
Right.
They may have supported it. They may have not supported, but they didn't. They didn't step over the line. You always have to have. You always have like that sort of group of firebrands that'll do that.
Right.
That will just be fearlessly sort of pushing that envelope all the time. The thing is at least getting support from the people that won't cross the line. Like, are you at least with us? Will you support us? Will you give $1?
Right.
Will you read a blog if it comes to you once a month? Those kinds of things. Like, keep an open mind. But we're a formidable force now. Like, this didn't
right.
exist 20 years ago. It was still hidden in church basements. So I have a tremendous amount of hope because we're not going to step back. We're not turning back.
Right.
We can't. We've come too far. And people, all the people who know who we are now, they're paying attention to us whether they want to or not. 10 years ago, they thought they still didn't have to pay attention to us.
Sweep us
but
under
they
the
have
rug.
to pay attention to us now. And we've learned. We have some skills. We're learning, social change methodology, and we're learning research methods, and we're learning like all kinds of things about how to push our issues forward. So, like I said, I have tremendous hope, tremendous faith that recovery is going to keep evolving. I think the biggest challenges we face are that we don't circle the wagons and shoot inward.
Right.
And as a field, we have a history of that. And that we start having an open enough mind to say, if we talk about multiple pathways to recovery, we talk about harm reduction as a public health approach that saves lives. We talk about all kinds of approaches, whether they're 12-step or smart recovery or refuge recovery or faith-based, and start working together.
Absolutely.
Because our differences are going to keep dividing us and separating if we let them. But eyes on the prize, I want to see anybody who wants to recovery to be able to get it. And anybody who's not there yet to be inspired in their own process about how to get there. And that's what we're all doing here.
And I think we need to. I talked about medication a couple weeks ago, and that was my thing with medication is I'm like, for starters, it's people that are prescribed medication, period. And it should be a person in recovery, period. People don't walk around going, hi, my name's David, and I have 12-step assisted recovery. Recovery is recovery, and we need to start looking at that. If somebody is, living the life that they choose to live and they're making those positive steps forward, I'm proud of them, and I don't care whether they believe, whether their holy book is the Quran, the Bhagavad Gita, or the Bible, or if they have no spiritual program, or if they're prescribed medication, they've gone to treatment, they've gone to prison, whatever it is, because there's truly multiple pathways to recovery, and there's no wrong path.
So you brought it up. So, the whole issue about medication, that's divided us for decades, right? There's a whole history of that. And now, medication, it's FDA-approved medications, evidence-based practice, known to save lives, and then there's still people in our field, in our community, that say, well, I don't believe in it.
Right. And
it's like, so my answer to that is, what about science don't you believe in? Because, this is all science-based, right? Some people don't, choose not to believe in science, whatever.
Right.
But it all boils down to methadone and buprenorphine, which are opioid-based. I mean, that's what it's all about.
Oh, yeah, if it was all Vivitrol, they wouldn't fight it.
For years, people on methadone weren't even granted the option to consider themselves in recovery.
Right.
They were shunned by the recovery community, and they were shunned by specific 12-step communities.
Oh, yeah, they wrote a bulletin about it.
And still are. And so, it's like, so first of all, I'm not a doctor.
Right.
But if you're prescribed medication by a doctor, that's good enough for me.
Yeah.
If you're working with your doctor to figure out the dosage and all that, that's good enough for me. If it's making you feel better, it's good enough for me. And if you are taking those medications and not doing heroin and not smoking pot and not drinking liquor and not doing all those other substances, then you are in abstinence-based recovery. And
Absolutely.
we need to change that terminology because people say, well, it's not abstinence-based. It is abstinence-based.
Right.
You're on medication that's being monitored and you're not doing any of that other stuff. And if you actually have a recovery program on top of that, all the better. Right. I talk about the three-legged stool: medication, psychosocial supports, recovery supports. That makes a whole person.
Absolutely.
So, do I believe that medication by itself is effective? It certainly addresses the symptoms.
Right.
But it doesn't really, by itself, usher in recovery the way we know it.
And I think that's a scary thing for some people is there's a push with medication, and I understand the meaning, why the reasoning behind it. Somebody, because they miss an appointment, shouldn't have their medication discontinued because that can kill them.
What other disease would we do that with?
None. Sorry you didn't show up for your doctor's appointment, so you're not going to get...
It's shaming and punishing.
Yeah. But there's also, by some people, been a push just to get people on medication and not give them any kind of foundation. And that's where I think some people have issue. I mean, if we look at some of the research, though, on like Suboxone, you're going to see that, what I love about Suboxone, some of the research, it shows that they're more likely to go to meetings, more likely to have a sponsor, and they're more likely to stay engaged. And the bottom line is it keeps people alive, and dead people never find recovery.
That's absolutely right.
So
yeah, I think, anything that helps, we're going to embrace. We're going to figure out a way to incorporate. Anything that doesn't help, we're going to push to the side. And it's like it's anything in recovery, I've learned to have an open mind and a what if kind of attitude. And unfortunately, not everybody in the recovery community is there yet.
Right.
But that's what it's part of our development is that we think differently than we used to, and that we're open to different possibilities. Right. Not only for myself, but for you and for everybody else.
Absolutely.
I mean, it's as simple as that, but so hard to achieve, like so hard to put into practice.
So I think we're going to wind down. I'm going to ask you one last question, I think. So when I talk to somebody who tells me they're an advocate, or they tell me that they want to become an advocate, I tell them this. You're not an advocate if you have to walk up to your state rep or your senator and introduce yourself. Right? Because if you're actually an advocate, not if you're becoming an advocate, but once you're an advocate, they should know you by name. You should have them, if you have a recovery community center, a treatment center, a recovery house, you should have already had them over and given them a tour and talked to them about all the positive things you're doing and let one or two people share a success story with them.
Oh, David, you're so hardcore.
So if you have somebody who says, you know what, I want to become an advocate for the recovery community, what are the first three things you would say, hey, this is what you need to do?
The first thing I'd tell them is to shadow David. Or find a David and shadow.
Right.
Because this is part of my responsibility. I always say to whom much is given, much is required. And I've been given a lot. So I take mentoring very, very seriously. And I mentor lots of young people who ask me. And so it's, you give it away. And so, but they have to be willing in order to ask for it. And in order to stay the course with it. So that's sort of the first place I go, or to connect them with people like you. It's like, you really need to shadow David for a month or 3 months. And so that, because a lot of what you said is totally true, but not everybody's there yet.
Right.
And part of it is building up confidence. And so, and the system that you're talking about, those kinds of legislative leaders, that system is designed to exclude.
Right.
So you have to help people sort of find their comfort level and push them into it gently. So I think that's an aspirational goal that you stated, but I think it's a process of helping people get there. Because I just know for so many people, especially in early recovery, everything is, every obstacle is just a huge insurmountable wall. And then to help people scale that down and walk through it, not walk around it, not climb over it, walk through it. So I think it's baby steps. And for people that are not used to disclosing their recovery status, that's scary. Like going to the state house is scary the first time. Right. And that's why we have to develop tip sheets for people and teach them how to talk and tell their story in an appropriate way. But, I think all of those things are lead up to what you're talking about. So, like, when you get to the point where they know your name or they greet you by first name or they come to your event in the community, you're on some solid ground. The problem is that when they get elected out, then you have to start all over again with somebody else.
Right.
But that's, it's part of that is just willing to be visible and vocal with your recovery as the access, and that's, people need to learn how to do that.
Yeah, that's why I like and don't like term limits. I like term limits because I think we need fresh, innovative thinkers. switching in and out, and we don't need people to kind of build up that good old boy system. But at the same time, you build that relationship, and you get somebody that's on fire, and then they're like, man, sorry, but this is my last, this is my last term in there. And you're like, well, can't you run for Senate from the House? We're trying to push some of those people to stay there because they've been such a powerful voice.
Yeah, and I'll share a little secret with you. I don't know how to say this. I am essentially not a political animal. I don't have the stomach for politics.
Right.
What I love is teaching people how to do it and organizing people to do it, organizing groups to do those legislative visits,
right,
to figure out who's going to go first, who's going to, that's what part of that is just because I love working with community people and I love seeing that spark happen. It's like I can be in a room full of people in recovery, especially people in early recovery, and I can sniff out all the leaders, all the potential leaders in the room. They don't even know it yet.
Right.
But I can see that spark, and I love when people go back and get their GED. People who dropped out of school, and then they have that hunger for knowledge. And then just getting them to go to community college. It's
right,
to get them to cross that threshold is so intimidating because all their life they've been told they're not college material. And to see them learn and progress and get degrees and get fulfilled, it's like, I know it happens outside the recovery community, but in the recovery community, it's like, that's really taking advantage of your second chance.
So you're preaching to the choir on that. I'll share something with you really quick. I turned 21 in prison, and I always say the only good thing that I did when I was in prison is I got my GED. And then at 29, I found out that I'd scored high enough on my GED that I took at 21 to get a scholarship, so I started at an area college. And I got an associate's degree, and from there I transferred into a college for my bachelor's, and that was intimidating. I had to go in front of the dean and explain to him why he should let me, a felon, attend his college. Right. But by the time I got to my master's degree, when I wrote the reason they should, you got to write right, kind of that reason why you should let me in, it was all about my recovery because I'd gotten that confidence, and I think that's something we forget sometimes, or at least I do, is I forget how hard it
absolutely.
Is to share, especially in the very beginning.
It's like all the confidence I have came incrementally, and it came as a gift, but I didn't have any of it.
Right.
So I love your, you're the poster child. You're a recovery success story, the kind that just delights me so much. Because we all share a collegiate friendship now,
right,
like we're colleagues in this world, and we all sort of got there through a very
right,
similar path, right?
Yeah, and there's amazing people. You talked about Tom Coderre. You talked about the fact that we had a drug czar that was actually in long-term recovery. We have Bill White, who's kind of the historian of the recovery movement. It's amazing. I feel like I walk in the shadows of giants all the time.
Well, I do too. I always say, it's like we walk in the shadows of giants and we stand on the shoulders of giants because so many amazing people have come before us, and many of them are faceless.
Right.
Right. But they forged all of this. So so I was at I do a lot of work with the collegiate recovery groups, and I addressed that leadership summit a few weeks ago. And I addressed them, and it was just like, these are young people, and I said, like, you cannot take for granted the seats you're sitting in, because people, there was blood, sweat, and tears that happened
right,
to make those seats available, and you need to pay homage to that all of the time and never take it for granted. But you have to know your history, and you have to know that what's being given to you right now is the culmination of a lot of hard activist work to make that
right,
happen, and that to whom much is given, much is required.
Absolutely. We wouldn't have the recovery movement we have right now if it wasn't for, I think of national organizations like Faces and Voices of Recovery and Facing Addiction. And it took a while to get those and to get the support and for those people to build that up. So I want to summarize really quick what I heard you say for an advocate. So an advocate, number one, it's kind of like a sponsor. Find somebody whose life you want. Find that person that you're like, I want to be like that person in the community. And I always say anytime anybody comes up to me and they're like, I want to do what you do, I'm like, be better. Please. I just ask you to do what I do and be better. Second thing you said is because it can be kind of scary to share your story at first. Maybe get that story together, get it written down, and maybe start sharing it in front of smaller groups and build up.
Sure.
Okay. And
write it down, but practice it, right?
Right.
So you're developing an advocacy practice.
And that's kind of what we do with recovery language training. Is we help them. First, we talk about the better language to use, because it sounds a lot better whenever I'm in front of, say, a politician or a city council member to go, hi, I'm a person in long-term recovery, and what that means for me is, instead of going, hi, my name's David, I'm a junkie. Right? Okay, and then one more thing. Okay, we got those two. What's one more thing you would tell somebody? Just starting out.
Just trust yourself. That, because I think we're all experts in change. We've all undergone a personal transformation. And if you can scale that personal transformation up to a community or societal transformation, you know all of how that works. All you have to do is scale it up. And you know how difficult it is, and you know where all the obstacles are, and you know where all the setbacks are, and just remember all that all the time, that you're a complete expert at this, and you know what you're doing, and confidence will follow.
Right. That's what I always tell people. I say you're the world's foremost expert on your story. In closing, I just want to thank you for listening to the podcast. Please join us every week for new episodes. If you want to connect with us further, if you have any questions, topics you'd like to hear in the future, or maybe would like to be on the podcast sometime, you can connect with us at betterlifeandrecovery.com. There's a Better Life and Recovery page on Facebook, or you can, we're on Twitter, BLIR_NPO. Also, this podcast is part of the Studio DNA Podcast Network. You can find out more about the network at studiodna.media. Thanks a lot. Y'all have a great week.